Why American can bring cheap medication from Canada, but only for 90 days? Medication is cheaper everywhere in the world compared to the United States. Everywhere. But instead of comparing ourselves to the entire planet, let's keep it simple and fair. Let's compare ourselves to Canada. Same neighbors, same pharmaceutical company, same medication. Yet, Americans pay 8, sometimes 10 times more. I'm not here to accuse anyone. I'm just trying to understand how this makes sense. Same medication, same company, often the same factory. But when Americans ask, can we buy it from Canada? The answer is yes, but only a little. Apparently, Americans are allowed to bring medication from Canada, but only for less than 3 months supply, only for personal use, and you are not allowed to sell it. And this is where I get confused. So, if the medication is unsafe, why allow any at all to come to the States? And if it's safe, why only 90 days? It's either okay or it's not. And here's another part I don't understand either. You are allowed to bring it, but you are not allowed to sell it. Why? It's a good medication, right? It's the same drug, right? Same company, unless the issue is not safety, but price competition. Again, I'm not saying that's the reason, I'm just saying that's how it looks. At this point, sometimes I joke. It might actually be cheaper to buy a plane ticket, fly to Canada every 3 months, pick up your medication, and fly back than to buy it locally. But when airfare becomes part of the treatment plan, something is off. This is why Canada is a fair comparison. Canada is a clean comparison. The United States is actually wealthier than Canada. Canadians still pay for medication. It's not free. It's still expensive, to tell you the truth, just not crazy expensive. The difference is not 5, 10, 30%. It's 10 times, sometimes more. That's not inflation. That's a structure. Let's talk about this safety argument. I am a member of the American College of Surgeons. Canadian surgeons, they are allowed to be part of it. Why? Because same standards, same training, same oversight. Doctors from all over the world, and I am one of them coming from Tunisia, when we wanted to practice in the United States, we have to take all the exam and go through the training in the United States, but the Canadian doctors, they are exempt. So help me understand this. We trust Canadian surgeons and doctors with American lives, but not Canadian medication from the same companies. I'm not saying anyone is wrong. I'm just saying I do not understand it. And this one freezes my brain. Medicare behavior. You know that Medicare is the largest buyer of medication on earth. It has a huge leverage. So you'd expect negotiation power, right? Bulk buying, lower prices. But listen to this. Medicare is not allowed to negotiate. Again, I'm not blaming anyone. I'm just saying if Costco can negotiate toilet paper, you would think Medicare could negotiate insulin. I know America is generous, but this type of generosity is too much. Listen up. We are told Americans pay more for medication to fund innovation. Okay? But why are American patients paying for the innovation of the entire world? Same drugs, same companies, global profits, but only Americans are told to pay extra. That feels like innovation and more like generosity with someone else's wallet. And this is the part that breaks math: insurance. Sometimes when you use insurance, the medication costs more. I'm a surgeon. I work inside healthcare, and I still can't make math or common sense out of that. If someone can explain it clearly, please tell me, because I'm still trying to understand. And maybe this is why it bothers me so much. I am an immigrant. I came to United States, the richest country in the world, where capitalism thrives on competition, but not on medication. And yet, so many people struggle just to buy their medication. That's the part I still can't understand. Not the science, not the medicine, the fact that nobody seems to fix it. What I see in real life is simple. Patient ration medicine. They delay care. They make medical decision based on price. Sometimes that's harmless, sometimes it's catastrophic, and that should never be normal. If medication cost is affecting your care, don't stop silently. Don't assume there are no options. Don't disappear. Clarity always beats guessing. I can't wait for Canadian to be part of United States. You know why? As a surgeon, the medication price would drop like a rock. This is Dr. BenMaamer. Hit follow to help build momentum to fix healthcare in America. And again, if someone can explain how all this is supposed to make sense, honestly, let me know. I'm still listening.